Hello everyone, we are going to present our research. Is the presence of the four molar and atavistic lot of the pre-Inca and Inca culture? To understand the atavistic lot of this individual, we analyze the archaeological remains of schools of the pre-Inca and Inca culture located in the Museum of the Universidad Nacional San Antonio Abad del Cusco. In this work, we present a clinical case of a four molar. The patient is 16 years old. After the informed consent, he was evaluated, tested, and treated. In the clinical examination, the permanent dentition we show with absence of the third molar. The panoramic X-ray show the presence of the third molar in a vertical position at the level of the mandibular tuberosity. And the computed axial tomography showed the partial erupted fourth molar in a horizontal position at the level of the right triangle. Diagnosis was fourth molar in a horizontal position in proximity to lower right, the third molar. The treatment was the extraction. The surgical planning was using complementary tests such as CT scan, we collect area, we apply stereolithography, 3D printing to achieve and planning the surgical approach. The surgical approach began with the blockade anesthetic and the final archaeological remains of the pre-Inca and Inca culture. The observational technique was carried out through the anthropological macroscopic review of the human bone remain belong to the individual from the Inca and pre-Inca time located in the Inca Museum prior authorization. The total population was 255 skulls and are codified and stored in the anthropological cabinet of the museum. A photography and radiography examination of 15 skulls carried out and data collection sheet was prepared for registration and the information.
Discussion studies on the possible atavistic load with the influence of the Inca and pre-Inca culture for the presentation of four molars and their etiology are not yet conclusive. However, all the presentations of the four molar include the genetic factor as a possible origin. The four molar case report was presented in an adolescent patient from the city of Cusco with ancestors from the same region. In the Inca Museum of the city of Cusco, 256 skulls from the Inca and pre-Inca culture were found, where a total of 50 skulls were reviewed. No finding of four molars were reported. These results could be due to the limited sample to which access was obtained. However, more conclusive studies are required to find a relationship between atavistic load and the presence of four molars. The use of emerging technologies for surgical planning, such as CT scan and 3D printing, offer us a new alternative with better efficiency for the diagnosis and treatment of patients. Thus, improves dental procedures and minimize possible errors by reducing procedure time, improving the precision of the surgical approach and its evidence in the success of the treatment for the benefit of the patient. Also, due to its versatility, it's applied to various areas of dentistry. In the conclusions, we can find that the presence of four molars in ancestral population and their possible atavistic load of the Inca and pre-Inca culture require more conclusive evidence in order to find an adequate theory for the benefit of science and culture. The contribution provided by the use of emerging technologies such as CT scan and 3D dental printing for surgical planning in the area of oral surgery is very important and constitutes a great scientific and technological contribution to advances in the area of digital dentistry. It should be included in the complementary exams in surgical planning for dental students for the benefit of their academic training. Thank you very much.